So the question is, what is personal injury? And it really helps if you just keep this in mind. I remember when I was practicing, it was like this cloud. You kind of think of personal injury, and it was mysterious. What's behind the red curtain? And it's not. It's not like that at all. It's actually, if you just really, to be honest with you, if you just documented everything with high sensitivity and high relevancy documentation, that's all it would take. But unfortunately, that's not what's going on. So, what is personal injury? Well, it's a very specific category where we're essentially quantifying injuries for financial compensation. I mean, what other reason would we put a number on an injury? Well, that's the reason. It's really we put numbers on injuries for workers' compensation and personal injuries. So work injuries and non-work related injuries. And that's what we do them for. They're for financial compensation. That's as simple as it gets. Personal injury is the quantification of injuries for financial compensation. Now, there's some very important factors relative to this that the documentation becomes unbelievably important. So not only what we call high sensitivity, high relevancy, high probability documentation, primary, secondary factors and categories, and we'll get into all those factors. But when we're looking at these factors, we're looking at how relevant it is to that case. So we want to do things that are very specific for that particular case. And of course, that is what creates the value. So we help with the diagnostics, we help with the therapeutics, we help with the documentation. The documentation not only through the examination, SOAP notes, re-exams, and then when the case is done, we put it all together into what's called a narrative report. The narrative report is just an accumulation and the end result of that case. That's all the narrative report is. And then from the narrative report, sometimes you're asked to testify. Now, it doesn't happen very much. Matter of fact, 95% of the cases never even go to court. But if you do go to court, it's very good to know how to do that. As a matter of fact, the most valuable thing you can do for a personal injury attorney, besides the documentation and doing the narrative report, is know how to go to court. That's the most valuable. In other words, you want to be the most valuable partner with an attorney. That's the most valuable thing you can do, is learn how to testify in court to the documentation. That's it. Okay. So that's the importance of and the definition of what we're going to be taking a look at. And so we're going to pay a lot of attention to quantification. So we're not only going to look at all the different injuries, but we need to quantify them. And the reason we need to quantify them is we need to know if the patient's getting better, worse, staying the same, or are they going to end up with a permanent injury to some degree? And if it's been quantified, we'll not only know all that, we'll know to what degree has it become a permanent problem. So quantification of all of these therapeutic categories become unbelievably important for personal injury. Okay.